Hello, everyone, and welcome. Today, we're going to dive into what I believe is the most fascinating subject in all of medicine: pathology. Why? Because it's the very foundation, the bedrock upon which all our medical understanding is built.
And I want to start with this quote from Sir William Osler, one of the founding fathers of modern medicine. Just think about what he's saying here. He said this more than 100 years ago, and it's never been more true. Your entire career, every patient you see, will depend on how well you grasp the concepts we're about to discuss. You see, the best way to think about pathology is that it's the language of disease. It gives us a structure, a framework, to make sense of what's going wrong in the human body. It teaches us to ask the right questions.
And those questions are fundamentally these three: why did this happen? How did it unfold? And what are the consequences? This simple framework applies to every single disease, from a common cold to a complex cancer. So let's make this practical. Let's take a very common scenario you'll see again and again: a heart attack.
First up is the etiology. That's the fancy word for the why. What is the root cause? In our patient who's having a heart attack, the etiology, the why, is almost always atherosclerosis. That's the buildup of plaque that narrows the arteries supplying the heart. That's the underlying problem.
Okay, so next we ask about the pathogenesis. This is the how. It's the step-by-step sequence of events that connects the cause to the result. So in our example, that atherosclerotic plaque suddenly ruptures. On top of that rupture, a blood clot, a thrombus, forms, and that thrombus completely blocks the artery. That entire cascade of events, that is the pathogenesis. And finally, we look at the what. What is the end result of this whole process? Well, this can be divided into two things. First, the morphologic changes, the structural damage. In this case, it's the death of heart muscle cells, what we call necrosis. That's the lesion. And second, the functional changes. Because the heart muscle is damaged, it can't pump properly, and that leads to the chest pain and breathlessness, the signs and symptoms you see in your patient.
So we have this really logical framework today, right? The why, the how, the what. But believe me, it wasn't always this clear. Let's take a quick journey back in time to see how we got here, through what were really three major revolutions in how we think about disease.
For thousands of years, medicine was dominated by this idea of the four humors. The belief was that disease was just an imbalance of these fluids in the body. It was all based on philosophy and speculation, not evidence. And this bias held back medical progress for a very, very long time. The story of modern pathology really unfolds in three great leaps forward. Each one took us deeper and deeper. First, we started looking at whole organs. Then, we zoomed in to the level of the cell. And finally, we plunged into the world of molecules themselves. The first revolution, the gross revolution, was kickstarted by people like Giovanni Morgagni. What he did was simple but revolutionary. He performed hundreds of autopsies, and for each one, he carefully documented the patient's symptoms when they were alive and then correlated them with what he found in their organs after death. He was the one who really established this crucial idea of clinico-pathologic correlation, or CPC, which is the cornerstone of diagnosis today. Then came the next giant, Rudolf Virchow. Armed with the microscope, he proposed a radical new idea that all diseases are, at their core, diseases of cells. He said, omnis cellula e cellula, all cells arise from other cells. Suddenly, the focus shifted from the organ to the tiny building blocks of the body. This is a concept that you absolutely must master. And the third revolution, well, that's the one we're living in right now, the molecular revolution. It really took off with the discovery of the structure of DNA. This took us to an even deeper level of understanding. We could finally begin to understand diseases at the level of our genes, which opened up the secrets behind everything from hereditary conditions to the development of cancer. So that's the history. But how does all of this actually look in a hospital today? Let's quickly go over the modern branches of pathology that work tirelessly behind the scenes, guiding pretty much every clinical decision. Broadly, you can split the field into two big areas. You have the morphological branches, which are all about looking at structure. Things like histology, where we look at tissue biopsies, or hematology, looking at blood cells under a microscope. And then you have the non-morphological branches, which analyze function, chemistry, and molecular data, like clinical biochemistry or molecular pathology. Now, of course, technology is constantly changing how we do things in all these areas. And it brings up a question that would have sounded like complete magic to Virchow or Morgagni just a century ago. And the answer is something called telepathology. What we can do now is take a glass slide, put it in a high-resolution scanner, and create a virtual slide. This massive digital file can then be sent over the internet in seconds. It means an expert pathologist in Delhi can diagnose a patient in a small village in Kerala. It's an absolute game changer for access to healthcare. Okay, so we've covered a lot of ground, from history to modern practice, but let's bring it all back home. Why does all of this truly matter for you as you start your journey in medicine? Please, if you remember nothing else, remember this slide. Pathology is not just another subject you have to memorize for an exam. It is the vital bridge. It connects all the basic sciences you learned, your anatomy, your physiology, your biochemistry, to the actual living, breathing patients you will see in the wards. It is the science behind the art of medicine. And so, I'll leave you with a final thought to ponder. As our understanding gets more and more sophisticated, and as we develop technologies that can literally edit our own genes, how is our very definition of disease going to change? What will it mean to be normal or healthy in the future? That's a question your generation of doctors will have to answer.